Your child is special, unlike any other in the world. The first 2 years are such a wonderful time for getting to know your child and seeing them grow and change every day. And as the parent of a child with epilepsy, you are no doubt very concerned about the health and well-being of your child and want to do the best you can for them. When seizures happen, they can be very frightening, and it can be difficult to know how best to help your child. You may also worry about what the future will bring.
It's hard enough as the parent of an infant without the added responsibilities of a child with epilepsy. Sometimes it just seems so overwhelming. And I just feel helpless at times because I wish that there was something that we could do for our child.
We understand that seeing your child experience a seizure can make you feel powerless or frightened. This is why it's important that you become informed about this disorder and its treatments. A seizure is uncontrolled electrical activity in the brain that occurs when nerve cells fire electrical impulses much faster than normal. When a person has 2 or more seizures, they are considered to have epilepsy. Epilepsy can get worse over time, but it can also get better. Seizures may be generalized, meaning they involve the entire brain, or they may be partial. Now, partial seizures begin in a specific part of the brain, and they may affect only one side or part of the body, or they may affect the entire body. Seizures can cause strange sensations and behaviors, convulsions, muscle spasms, and loss of consciousness. If epilepsy is not treated, seizures can occur throughout a person's life and in some cases become more severe and frequent. Quality of life can be affected, as can a person's independence and self-esteem. For children, seizures can interfere with schoolwork, behavioral development, and other activities. The most common treatment for epilepsy is antiepileptic medications. However, more than 25% of pediatric patients are unable to control their seizures with an antiepileptic medication currently on the market. This is why new medications are so greatly needed.
A new medical research study is underway for children 23 months and younger who suffer from seizures. This study is called the Lavender Study. Doctors are conducting the Lavender Study to determine the effect of an investigational oral liquid medication in combination with standard approved treatments in children with epilepsy. If your child is 23 months old or younger and currently taking at least one anti-epileptic drug to control seizures, you're invited to see if he or she may qualify for this important medical research study. Before a medication is made available to patients, medical research studies are conducted to see whether the medication is safe and effective. Medical research studies must follow strict rules set by the Food and Drug Administration and must be approved by an institutional review board known as an IRB. All volunteers who take part in a medical research study are supervised by a doctor and other research professionals. The medication is referred to as investigational because it is still being tested to determine how safe and well tolerated it is.
If your child participates, you will be asked to complete up to 5 visits over the course of up to 4 weeks, including a 12 and 24-hour stay. Families may be reimbursed for their time and travel. During the course of the study, participants will receive the investigational medication being tested or a placebo, which looks like the study drug but has no active medication. Parents will need to administer the study medication twice daily in an oral liquid form. Upon completion of the study, participants may be eligible to receive the study medication for an additional year.
I was never aware of medical research studies or the high level of care that my child would receive while enrolled. I'm going to talk to my doctor to find out more right away.
If you are interested in seeing if your child qualifies for this important medical research study, you will be given detailed information on the study and the possible benefits, risks, and side effects of the investigational medication. A doctor will review with your family what you and your child will be asked to do. Once you have discussed specifics of the study with the doctor, you will be asked to review and sign an informed consent form. By signing an informed consent form, you indicate that you understand the information regarding the possible risks and benefits, and that you permit your child to take part in the study if he or she qualifies. When your child takes part in a medical research study, participation is voluntary. That means you have the right to take your child out of the study at any time. If you ever have concerns regarding the study or questions about the medical care your child receives, we urge you to talk with the doctor or research staff member. You also may contact an IRB representative at any time. If your child is less than 23 months old and experiencing seizures, please consider participating in the Lavender study.
This study interests us, and we wanted to find out more about it. It's also satisfying to know that this research could help other families as well. We like knowing that we could possibly help make a difference.
Ask your doctor for more information on the Lavender study, and if your child may be eligible to participate. Visit www.lavenderstudy.com or call 1-800-772-4488 for more information.